All right. So again, the title of this presentation is Navigating Retention Challenges of Peer Specialists. And as Billy said, welcome to this peer workforce conference. And we hope that you gather a lot of information out of not only this session, but out of the sessions throughout the day. Before we get started, I want to ask if you would put in the chat whether you are a supervisor who is also a peer, a supervisor who is not a peer, if you are a peer, or if you're some other person attending, and if you would identify what that other is. All right, thank you, thank you. Okay. All right, thank you. I'm a peer with the exclamation point. That's exactly how I feel, Frankie. I am a peer. Okay, thank you. Okay. Okay. Thank you all so much, because this again will be very valuable to those who are supervisors, and then those who are peers, they will be able to understand some of the backstory of what we're discussing. And then again, please hold any questions to the end and type in the chat if you have any questions. And he read my bio. And additionally, I am in the process of getting my Medi-Cal certified peer support for the state certification of California. Yes, I'm waiting to take my state license exam. I went through the course, and so that's my next step. Because as a peer support, as a United States Army veteran, first of all, and then a peer support specialist, I support veterans in the community. And I want to make sure that I have everything I need to do the very best job that I can do as a peer specialist. So our agenda, what we're going to do this morning, we're going to talk about our objectives. Why are we here? Appreciate that, Megan. Why are we here? An overview of what we're going to talk about, the challenges and strategies for peer retention. I'm going to do review and takeaways, and then I'm going to end with our Q&A. So our objectives, first of all, we're going to understand the unique challenges faced by peer specialists in terms of retention within mental health settings. We know that by definition, peer specialists have had experiences with mental health services. We already know that. And they're positive and negative. And so when they go to work, they meet with people, they have employers, they have coworkers who may not understand that. And one of the, for lack of a better word, downfalls of being labeled as a peer specialist, you go into work and everybody already knows that there is something going on with you. As a peer, you disclose, because in most instances, the requirement to be a peer is to have had mental health connection. So people will know going into work that you already have these situations. So there are unique challenges that come with this. It's not just you're a peer and you can work just like everybody else. You have challenges too. So what we are going to try to do today, or attempt to do, is point out for our supervisors what to look for and what to do. Also, we're going to identify strategies and best practices for improving the retention rates among peer specialists, because there are times when the peer does not feel like they belong. And most people, if they don't feel like they belong anywhere, they leave and go find another job. It may be in the same field, or it may be in a totally different field. And lastly, develop actionable plans for fostering and encouraging a supportive and inclusive work environment for peer specialists. Because again, if I don't feel like I belong here, guess what? You will see my resignation letter, or I just won't show up. So when we talk about the retention of peer specialists, we're looking at their unique challenges due to the intersection of their personal lived experiences with the professional development needs and organizational dynamics. So as a peer, we have lived experiences. That's what we bring to the table. But then we meet those who have treated us in one shape, form, or fashion. They may not be the same person, but we have that dynamic. And then the organization that we are employed by, where we're working. So we aim to explore these challenges comprehensively and equip supervisors with effective strategies to enhance the retention rates among peer specialists. Easier said than done, because it takes a lot of work. With a employee who is not a peer, they come in, they go to work. If they have personal problems, they take them home, they deal with them in certain kind of ways. But with the peer, sometimes our personal problems end up in our workplace because we've identified them and we're learning how to deal with them, or we know the steps that we need to take to deal with them. And sometimes it happens in our workplace. So it's not something that we can turn on and turn off, because we've already acknowledged that these problems, these issues, these challenges exist within us. So let's start with the first challenge. First challenge, understanding lived experience. Personal backgrounds and lived experiences. Peer specialists, they bring these diverse backgrounds and personal experiences to their role as a peer support specialist, because that is what they do. I share my lived experience with those who I'm supporting. So I'm bringing it to work. It's there. I may not bring it all to work, but I know that as it is compartmentalized, I will be able to share certain parts with people who I am supporting. So my personal background, my lived experience, they come into the job with me. And sometimes things happen where I might be triggered. And then I need to be able to have a plan at work to deal with that and be able to continue to perform my responsibilities. And then also, when you understand that lived experience, you have to look at the stigma, the discrimination, and burnout. Those are three things that really cause a peer to leave their position. Stigma. We know that mental health, the recipients of mental health services have been stigmatized throughout history. The stigma happens, people look at us, they just see the word peer and they already form an opinion of who we are, discriminating against us because of who we are. And then because we are in a dual role, if you will, we're trying to fit into the employee's place, but then we're also dealing with our own personal experiences. And sometimes that causes you to burn out, because you're essentially, you could say you're burning the candle at both ends, because you're trying to look like a regular employee while you're dealing with your own personal experiences and your lived experiences. We bring a wealth of personal experience to our roles. And again, these are rooted in our journeys of recovery, whether it's mental health challenges or substance use disorders. And because we have these experiences, we take the experiences and we allow them to shape our perspectives, our values, and our approaches to supporting others who have had similar paths to us. Because as a peer, and you all know, we're supporting others who have similar histories as we have had. They may not be the same, but they may be similar. So I'm taking my experiences, I'm taking what I have learned, taking the plans that I have learned, I've taken the steps that I have taken, and I'm sharing them with the person that I'm supporting. And in these experiences that I've gone through, they shape my motivation, they shape the challenges that I'm facing, and then they definitely shape my professional aspirations. What am I going to do after this? So when we talk about understanding the lived experience, personal backgrounds and lived experiences. Once again, we bring these diverse backgrounds and personal experiences to our roles. We will meet people who we've worked with, who we are working with, who have not done anything close to what we have done. Having been in the military, when I talk to people who have never been in the military, their eyes get wide because some of the things I share, they just cannot believe that I went through them and survived. That's a veteran talking to a civilian. But then a veteran talking to another veteran, we're nodding our heads and we're saying, yeah, I remember that. Yeah, I did something like that. And so when we have our backgrounds, depending on where you're working, your background can be an enhancement or it can be a detriment. Because again, it depends on your environment, depends on what's going on there. That again, they shape our motivations and our challenges and our professional aspirations. When we as supervisors understand and acknowledge the diverse backgrounds and the lived experience of peer specialists, supervisors are then able to cultivate empathy, respect, and cultural humility within the workplace. Because as a supervisor, you set the tone for the area that you supervise. You set the tone for the area that you supervise. I'm going to say that one more time. As a supervisor, you set the tone for the area that you supervise. So there are things that you must do to encourage a sense of validation and belonging for the peer specialists that work in your area, because this is essential for building trust and building rapport with colleagues and also the service users, those who the peer specialist supports. I remember working in an area where I was on an interdisciplinary team, and some of my colleagues did not understand the value of peer support. They brought a case, we were discussing a case. The provider said that was describing the person, describing the client, and we asked, did you offer them peer support? And the room got quiet. It was almost like we had said something dirty. And the provider said, yeah, I did. And then we said, well, what did he say? Well, he said he didn't want a crazy drug addict working on his case. And then again, the room got quiet. And then the peers asked, then what did you say? And the person just shrugged their shoulders and said, okay, I won't refer them. So those are the kind of things that as a supervisor, with your leadership, you can make that a teaching moment where the other providers recognize the value of peer support and recognize that what they are able to do brings into play the treatment and the recovery-oriented goals of the person that they're serving. So addition to personal backgrounds and lived experience, there's the impact of stigma, discrimination, and burnout. Because of mental health, mental illness, because of substance use, there's a discrimination and stigma that's attached to that. And just like the example I gave, some providers still don't understand that those are valuable experiences and not detrimental. For the peer, the constant exposure to this kind of stigma can lead to emotional exhaustion. I'm tired of feeling this way every time I leave work. I'm tired of feeling this way while I'm at work. Compassion fatigue. I'm looking at what they're doing to the others, those that we're supporting. I'm looking at what they're doing and how they're treating those who come in for services. And then, of course, burnout, because I'm trying my best to do everything that I can, but an interdisciplinary team is just that, a team. So we should be working together. So to avoid that first challenge of retaining peers, the supervisor plays a very vital role in getting the team, getting coworkers to understand the lived experience of the peer. Now, when we look at strategies for this understanding, create a supportive work environment. As a supervisor, you can do this. Creating that supportive work environment, provide resources that are crucial to addressing these challenges. There are many courses, many online courses, many booklets that can help your team to understand what a peer has gone through and what a peer goes through. And then the second one here is encouraging that open dialogue in your supervision meetings. Encourage dialogue between providers who do not know about peers and the peers. Now, we're not saying that the peer needs to spill all their guts to the whole team at this meeting. That's not what we're saying. But making an atmosphere where questions can be asked, understanding can be cultivated, and everyone is listening so that they know the value of their coworkers. Then developing peer support networks within your own company or organization, as well as networking with other organizations that have peer support. There are many online groups of peer supports where peer supporters come together. Many of the organizations that offer peer support training have some type of peer support networking group. If you went through training with some of the organizations to get your state certification, they have peer support mentoring groups. So being able to get into a network of peer supports will help that peer support. So as the supervisor, supporting the peer in finding this network, supporting the peer in finding a way, an outlet for them to deal with what's going on at work. And then understanding and acknowledging the backgrounds of the peer, because what that does, it facilitates empathy and respect within the workplace. Not just calling a name or not just calling them what they are, whatever the illness is, whatever the substance use is, instead of referring to them as in that manner, referring to them with respect, the same respect that you would refer to any other colleague. And then providing resources for self-care, which might include providing flexibility in scheduling. It may also include workload management, or also may include other kinds of accommodation for the peer. But again, because there's a conversation about it, the peer does not feel like they're being singled out, but there's an understanding within the whole team of how valuable the peer is, the background of the peer, and how important it is for all of the members of the team to be able to work together. And in building that supportive environment, it's required as an intentional effort that promotes inclusion, diversity, and psychological safety. As a supervisor, once again, promoting that open dialogue, active listening, and that fosters a sense of belonging and community, which is what we all need. And then lastly, understanding and acknowledging their backgrounds, as well as the need for self-care, as well as meaningful involvement in the decision-making of their role in the course of the treatment of whoever they're supporting. If they have decision-making, if they're part of the decision-making process, then they're empowered. And when they're empowered, then they too can empower those whom they're supporting. So our second challenge, professional development and career advancement. When a peer support becomes a peer support, where can they go? If you have 5 peer supports in an organization, only one of them can make it to supervisor. And if that one makes it to supervisor, If you retain that one, then the others don't have a chance to make it to supervisor. So you want to look at growth opportunities within mental health organizations, within your own organization. Where else can a peer work where they can empower others, where they can support others, and where they can hone on their skills? And additionally, professional development, the barriers that come because, again, limited advancement opportunities, training gaps. When we go through our initial training, the 80 hours of training, as an organization, as a supervisor, are you offering any other types of trainings? Are you pointing the peer to other areas where they can get training? Those are some of the strategies that we'll get to enhance and encourage the professional development and career advancement. Because again, if a peer hits the ceiling, they have to go someplace else to get above that ceiling. So as a supervisor, are you promoting that ceiling in your workplace, or are you working on other areas for the professional development of the peer? So when we look at career trajectories, we seek meaningful trajectories aligned with our professional and personal goals. As a supervisor, have a conversation with a peer. What are your personal goals? What are your professional goals? Why are you here? What do you want to accomplish? When you find that out, then you can help lead and guide them in the direction so that they can be retained as a peer in the workforce. Because limited visibility will hinder their professional development. If I can't see myself getting any further than this, then I'm going to have to go someplace else if I want to go further. When we look at job satisfaction, asking a peer, asking anyone, when you get up in the morning to get ready to go to work, how do you feel? Do you dread going to work because this is a dead-end job? Or are you excited because after you do this, you get to move to the next level and the next level? So that becomes one of the challenges, because peers don't see a place to grow to, not just go to, but grow to. And then the barriers to professional development. Despite our valuable contributions, we encounter these barriers to professional development. We have limited access to training, and once again, the institutionalized stigma. There are people who have told us with mental illnesses that we can't do any better than what we're doing right now. And that takes away our drive, that takes away our motivation. So are you, as the institution, the organization, jumping on that bandwagon? Or are you advocating for equitable access to training and development opportunities? That becomes a personal question. What are you doing to support the peers in advancing? Advocating for additional trainings as a supervisor is definitely something that you are able to do, because then when the peer specialist receives these resources and the support, they will begin to thrive in their roles. They will begin to go above and beyond to do the support, to do their role, to do their responsibilities, to fulfill their responsibilities. Collaborating with external partners, leveraging peer-led training initiatives, and incorporating different learning methodologies can enhance the effectiveness and relevance of professional development programs for peer specialists. In our team meetings, we would often have a peer do a presentation about what they do as a peer, what their role is, what their responsibility is, how they supported a particular veteran. And what that did was show the others, showed the coworkers, the other members of the team, that this peer has potential. This peer is able to do some things. And then what ends up happening is, when, whether it be the supervisor or coworker, brings it to that peer an opportunity to learn something else, an opportunity for additional training, an opportunity for growth, because that is what anyone wants. No one, I don't believe anyone is happy just sitting in a job and not feeling motivated, not being able to thrive. They're sitting in a dead end position. We're in this time, in this day and time, our time is valuable. So whether it's our time at work or our personal time, we want to be able to make sure that it is meaningful. And in our workplace, not only to me as the peer, but also to those that I serve. And those of you who are peers, who've served as peers, we know that the service that we perform, that we provide, is not cookie cutter. You can't do the same thing for every person you support. So being able to learn more, being able to have those opportunities to get more exposure to what's going on in the peer world, those are tantamount to retaining a peer, because that shows that the leadership values them. That shows that as a supervisor, you value them. That shows that their role is important in the organization. So look at strategies for this professional development. Create transparent promotion criteria and skill building workshops. When we know where we're going, then we're excited about getting there. We work towards getting there. When we know that we need particular skills to move up, and knowing that as a supervisor or as leadership, you are advocating for those skill building workshops, that makes the peer feel valued. Oftentimes, in an organization that's not peer run, the peer is, for lack of a better word, low person on the totem pole. And because they're low person on the totem pole, their training is not seen as very important. Oh, they're just going out and taking them to the movies. Oh, they're just going and helping them grocery shop. Oh, they're just going and making sure that they're at home. Being a peer and being able to bring your lived experience to your workplace presents a valuable opportunity for you to be supported and supportive of those that you serve. Offering mentorship opportunities as well as peer-led workshops. There are peers who take all kinds of training, who go outside of the box, outside the organization, and find trainings, encouraging them to bring that information back and sharing it with the other peers. That needs to be encouraged, not looked down upon, not pointed out as, oh, you think you're better than others. Because as peers, we're supporting one another as well as those that we're supporting on the outside. Recognizing and celebrating milestones. Those milestones in the life of a peer are very important. Those milestones, completing programs, achieving certifications, even sobriety birthdays. Recognizing those milestones bring value to what the peer does in their life, in their personal life, and also in their work life. Because as much as we want to separate it, sometimes we cannot separate our work life from our personal life, because we're bringing our personal life to support those whom we're supporting. And then investing in leadership development training for supervisors. That's an important component, because if the supervisor is not a peer or has not had the peer training, they don't understand what the peer is doing. They may not be able to validate or explain or support what a peer is doing to colleagues, to upper management, to other supervisors. So being able to, as a supervisor, being able to have your leadership skills develop so that you can work with peers. The unique circumstances of a peer, the unique challenges of a peer, they are unique. That's not just a word that we threw in. They are unique. And so as a supervisor, you have to be able to support the peer that's under your leadership, so that as they are going through their workday, they know that they're doing what they should be doing. And one example, I went on a joint visit with a social worker. And as the social worker was doing their thing, I'm looking around the apartment and I see that the person that we're supporting is into Marvel characters. So he has a Superman toaster. He has a blender with Batman on it. He has posters of the Avengers on the wall. So after the social worker gets through, she asked me, "Do you have anything you want to say or ask?" So I introduce myself, tell him what I do, and then I ask him, "Do you watch The Big Bang Theory?" The social worker went ballistic. It's like, why would you ask such a question? And then I proceeded to explain to her the Big Bang Theory. For those who don't know, the Big Bang Theory is a sitcom where the characters are all about the superheroes, the Marvel characters, and his apartment looks similar to the apartment on Big Bang Theory because he had a Batman cookie jar and he had all these things. So when he asked that, so we were able to have a conversation because I was able to tell him about my favorite episodes. He was telling me about his. So we made a connection because remember, peer support is also relationship building because you're developing trust in the person that you're supporting. So however way you make that connection, you need to be able to make that connection. And as a supervisor, co-workers, you have to, as a supervisor, let's go there. You have to be able to explain to the colleagues if they don't understand. Another incident, not incident, but another episode.
Is the meeting frozen for everyone? Or just me? Okay, I see.
Oh, I'm glad you asked. I'm glad you asked that because I was starting to go through typing buttons saying, okay, did I do something?
Me too.
Same. Oh, she got booted.
Let's give her a minute to sign back in.
Okay.
Thank you.
Can you hear me?
Yes.
Okay, let me share the screen again. Okay. Oh, somebody didn't want me to say what I was saying. I was on a roll. Let's see. Yes.
Well, see, now you get to say it twice, and you know what they say when you repeat stuff, it's extra important. So
Awesome, awesome. Okay, can we see the PowerPoint?
Yes.
Okay, thank you. So yes, when I took the women to the beach and they had not experienced the beach sober, and they really enjoyed it because they were able to feel the sand, run their toes in the sand, not just concentrate on how do I get up because I've fallen down in the sand. So they were able to enjoy it. And that became a teaching moment for our supervisor because the supervisor was on the side of the colleagues who were complaining that we did this during the workday. And so after some education on what we do as peers, then the team understood what was happening. The majority of the team understood. There's still those who don't understand or didn't understand the value of the lived experience of the peer support and how they take that lived experience and share it with others who have had similar challenges. So being able to do these things for professional development will help in retaining peers because when a peer knows that they are valuable, when they know that their experiences are valid, when they know that their input into the service of a client is recognized, is valuable, is validated, then they're more than likely to stay there instead of leave to find another position. So our third challenge, organizational factors. Exploring, looking at the workload, the supervision quality, and the culture. I like that, Betty. I got a lot of flack for taking groups out to play on swings. Definitely. Yes, that does happen when you do something that others don't think of doing, but it's part of your relationship building. It becomes a teaching moment because people won't understand. Thank you. So our third challenge, addressing organizational factors. Workload, supervision, quality, and culture. These factors contribute to the turnover of peers. And these are things that have to be looked at within the organization, as well as the role of leadership in valuing peer specialists. It's a positive organizational culture that values the contribution of peer specialists. So without that, then the peer may move on to greener pastures. They don't like me here. They're not accommodating me here. They're not understanding what I do here. And they're not trying to find out what I do. So I'm out. I'm going someplace else. But that's not what we want to happen. So when we address these organizational factors, we're analyzing this. Inadequate supervision. Well, let's go first to heavy workload. Heavy workload. I've heard of peers that have 50 people on their caseload. I learned early on in my peer world, the peer support is voluntary. Okay, Megan, thank you so much. And that definitely plays a part here. If your supervisor is working with you instead of working against you, then yes, you're more likely to stay in that job. So the workload, I've seen peers who have 50 cases and they're being forced to go out and have a relationship with someone. You can't force a relationship on anyone. You can check in, and if they say, I'm good, I don't want to talk to you anymore, that's their choice in terms of notes that gets documented and you move on. There are those individuals who want someone to be with them, who want someone to support them, and in some cases who need someone to hold their hand while they're reintegrating into the community, while they're figuring out what to do in whatever state that they're in. The supervision quality in having inadequate supervisors, because as it was said, if you have a good supervisor, you're likely to stay because that supervisor will listen to you. And when I say listen to you, not just hear you, but they will listen to you, because there is a difference. You can hear me talking, and then at the end of the meeting, you say, okay, thank you, bye, and we're done. But then if you're listening to me, then you are listening to the issues that I have, the challenges that I have, those things that need to be addressed. And then also when you're looking at the organizational factors, ask them, collect feedback through surveys. And also when the peer does leave, ask them why they're leaving. Most places have an exit interview. So that will help you identify the root causes. Okay, so I have here in the comment in the chat box, I have the amazing honor of being able to assist in connecting people with their native culture and healing journey through sweat lodge, gardening, ceremony, traditional medicines, sage, sweatgrass, rosewater, first foods, and sober cultural functions. I love being supported by my team in this. That is awesome that your team does support you in that. Because in some areas, sweetgrass, I'm sorry, in some areas, the team, as I said before, does not support you, does not understand you, does not see why you are doing what you're doing. And in order to develop a relationship, you have to be willing to listen to what the person you're supporting is saying. What is important to them? Because it's not about you, it's about them. But you're also taking care of yourself in this process. So you're finding out, what do they need? What does the person that you're supporting need? And as you are looking at that, you need the support of your team. Because if your team members have not developed a relationship with that person, they're going to say that's not necessary. But the culture of the supervisor, the way the supervisor leads, has to encourage the listening. Okay, and okay, thank you. Because yes, bringing your own lived experience, working with those who have similar experiences, working with those who are the same culture as you, developing that relationship is important. And when you look at the ethics and the responsibility of a peer, we're the ones who self-disclose. We're the ones who share our experiences. Other professions do not. Other professions do not. The other members of the interdisciplinary team, they do not share that they've had struggles with addiction, that they've had struggles with mental illness, that they've had all these other things. They don't share that. But as peers, we have the opportunity to share it. And that helps to bring that relationship, that helps to find that connecting piece in our relationship. So in addition to the organizational factors, what role does the leadership have in promoting a positive organizational culture? So effective leadership models transparency, empathy, and accountability. What that means is the positive organizational culture is led by those who lead. Supervisors must lead by example. They must model transparent communication, empathy, and accountability in their interactions with peer specialists. Although this is not about the point I'm going to make here is gossip is not the place does not have a place in the workplace. And oftentimes peers become the subject of gossip because of their lived experience. But a supervisor has the power to squash that. A supervisor has the power to stop that so that the positive culture can continue to go. Leaders have to encourage a culture that values diversity, inclusion, and employee well-being. So when things happen that are not for the good of the employee, the supervisor has to recognize that and step in. When a peer is at the heart of a diversity challenge or at the heart of stigma or discrimination, the leadership, the supervisor, has the power to step in and re-educate, to step in and stop that, to step in and change the mindset or attempt to change the mindset or discuss the changing of the mindset. But all of this is a conversation. Why is this a problem when they being peers are here to help? As peers, we're supporting, we are a valuable piece to supporting the client that the other members of the interdisciplinary team have an opportunity to talk to. Sometimes the person we're working with does not want to talk to the social worker, but the social worker has to communicate with that person. The person we're serving may need to have the peer with them as a sense of comfort, as a sense of we are supporting you together. That's relationship building. When the person that we're serving has a challenge and doesn't understand why the team is not really understanding what the peer is doing, then that's where the supervisor and the leader jumps in so that they can make sure that not only is the person we're serving understanding of the roles, but also the other team members are understanding of the role. So we have to, as supervisors, have to be that model where we're showing transparency, empathy, and accountability. A peer support is also an employee. So there are things that, as an employee, that peer must do. And being able to do it under the leadership of one who understands is what is important, so that they can thrive, so that they would want to stay there. It's all about the connection. Exactly. Because if the person that we're supporting does not feel connected, then if something goes on, they're not going to call. They may fall back into addiction. They may relapse. Something may happen adversely because they don't feel like they're connected to the team. Nobody wants to be just a number. Nobody wants to be just a name. And the worst thing you can do is identify someone by their disorder. That is the worst thing that you can do. And sometimes when the team is meeting, they will identify the clients they're working with by their disorder or by their challenge. And it's up to the supervisor to continue to stop that, to say, we're not going to do that. This is how we're going to address the clients that we're going to talk about. We're not going to call them the schizophrenic that I was working with. We're not going to do that. The supervisor has to stop that before it gets started. And that's part of the transparency, the empathy, and accountability, because the peer is sitting there listening to staff talk about the clients that they're serving. So knowing that the peer was at one time on the other side of that table, now it's wondering, do people talk about me like that? And some know that they did, and some are still wondering, depending on how long you've been in the peer world. But we know that, as I said, thank you so much, promotes stigma, and it keeps stigma in the atmosphere. So as a supervisor, part of creating and promoting that positive culture is getting rid of that. So let's look at strategies. When a peer leaves the position, why did they leave? Looking at those things, looking at the performance evaluations, looking at the turnover data. This allows you, as a supervisor, insight into retention trends. If you have 5 peers that leave and they each say that I felt stigmatized by the team, then you need to talk to the team. That's something that needs to be addressed, because exit interviews are not just for the sake of filling out paper. Exit interviews have a value to keeping the next employee in the position, because if the same stuff keeps happening, the same results are going to keep happening. We know the definition of insanity: doing the same thing and expecting different results. If every time there's a team meeting, the stigmas, the discrimination, all of that comes out, then you're going to keep having peers leave the workforce. Provide opportunities for feedback, recognition, and professional development. This helps and supports employee growth. So when you see that as a peer that you are recognized, when you see as a peer that you're able to speak up, when you see that you are, as a peer, you are able to be recognized for what you are doing, then that gives you, that allows you to stick your chest out. Now, it's not saying that we do it for that, because as a peer, as peers, we get in the profession. I would say, I haven't surveyed every single peer, but of the peers that I have spoken with, 90% of them became peers so that they can support their fellow person. In the case of the veteran world, we became peers to support our fellow veterans. So those are the people that I've spoken with. And in a team, when you're looking at the team, if the peer is not recognized for what they are doing, once again, you're not recognizing me. You don't think what I'm doing has a place here on the team. You don't think what I'm doing is valuable. I'm going to find me another place, someplace else where they value me. So you want to provide those opportunities. And then establishing clear communication channels. Don't make it difficult for the peer to get to you as a supervisor. I'm not saying if a peer comes to you to drop everything and discuss with the peer right then, but give the peer opportunities to have conversations with you. Offer them opportunities during the meetings, like other disciplines are offered during the meeting. So, for example, during the team meeting, you want to hear from the psychologist, you want to hear from the psychiatrist, you want to hear from the social worker. And then you say, okay, that's good. Thank you so much for attending the meeting. And the peer standing there waving their hand. Wait a minute, what about me? Oh, all you did was take them to the movies last week. So I didn't think you had anything to report. No, taking them to the movie was a relationship building activity. It allowed them to go to a movie. Maybe they had never been inside of a theater before. But being able to have those clear communication channels so that if a peer has an issue, we don't have to wait until our next performance evaluation to discuss it. We don't have to wait until the end of the month to discuss it. Well, I have time on my calendar tomorrow at 1 o'clock. Can we do it then? Yes, I'll be there. Offer those channels of clear communication so that the peer knows that they can come to you as the supervisor. I love that, Betty. When I was supervising, if my open was open, come in. If it was shut, I was busy. And that's definitely a good way to supervise everyone. And I mean, yes, door. And that's a good way to supervise everyone, but also letting the peer know that they're part of that open door policy. Because if sometimes the peer does not feel welcome because of how they're treated. And then you want to establish mentorship programs and wellness initiatives. When we look at mentorship programs, a peer who comes into the workplace may be the only peer there. So as a supervisor, finding other resources or other peers, maybe of another organization, maybe of a national organization, to come in or to make a connection for mentorship for them to ask questions. If you as a supervisor are not a peer, if you as a supervisor, you may be able to mentor the peer in your supervision so that that peer can continue to do the very best that they can do. And then also the wellness initiatives. If the peer is not well themselves, then they will not be a productive employee. Because as a peer, we know what triggers us. We know what our stresses are. We know when we're having good days and bad days. We know what we need to do to be well. Establishing those wellness initiatives. For me, my wellness tool, my main wellness tool was listening to gospel music. So if I found myself in an area where I was triggered or I had a stressor, I would let my supervisor know I need to take 5. And I would go put my headphones on, listen to my music, and reground myself. And then I'm able to come back in and continue being that productive employee. So not causing a disturbance to take care of your wellness, but being able to, going back to the clear communication, the open channels, being able to let people know, that it is important that not only you as a peer maintain your wellness, but everyone maintain their wellness, and create opportunities for employee input and participation in decision-making processes. Oftentimes peers are left out because they are just a peer. Peers are not just a peer. Peers are the communication, the relationship builders. They're the goal setters. They're the ones who support the person that the team is supporting. So you want to make sure that the peer has a place at the table when decisions are being made, because otherwise they again come to the point where what I do is not valuable. You're just going to tell me what to do as an afterthought because you realize I'm sitting here and you think I need to do something since I'm getting paid. No, make me a part of the decision-making process. And as a supervisor, with all of that, to transform that culture so that it is understanding of peers, you don't take this information and just focus it on peers, because then the peer will feel another kind of way. Oh, you're picking on me. Oh, I'm standing out. Oh, nobody else has to do this but me. Make it a team effort where everyone is taking wellness breaks. Everyone is participating in the decision making. Everyone has an opportunity to offer feedback, to take advantage of the communication, and also to talk about what the peer is or is not doing, what they think the peer should be doing or should not be doing. All of that is constructive criticism for the peer, constructive thoughts, constructive help for the peer, because as a team, as the saying goes, you're only as strong as your weakest link. So everybody on the team should want everyone to be at their optimal best. Because again, if someone is not happy, if someone does not feel like they belong, if someone is stigmatized, talked about, discriminated against, they will not be there very long. And if there's a peer on the team and that peer leaves, then the connection to the client has been severed. And you have to start all over again. And unless the persons who are working with them are peers, they won't disclose that they had alcoholic issues. They won't disclose that they were in a mental hospital. They won't disclose the things that the person we're working with is going through. They'll be able to tell them what the book says. They'll be able to tell them what theory says. But the client, the person, the one that you're supporting needs that hard evidence. I need to see that I can overcome this. And peer support works, because when you look at a peer and you see where they have come from, you hear where they have come from, and you see where they are now, that tells you that peer support works. So our review and takeaways. We explored retention challenges faced by peer specialists, focusing on understanding their lived experiences, addressing their professional development needs, and also addressing organizational factors. So when we acknowledge and address these challenges, as a supervisor, you play a pivotal role in improving the retention rates and encouraging a supportive work environment for the peer specialist. As a supervisor, you play a pivotal role because we look to our supervisors for support. Because the supervisor, when you start a position, the supervisor says, whatever you need, let me know. I'm here to help you. I'm here to support you. But then when you go to them for support and they're not there, when you're sitting in the meeting and you're hearing the stigma just going back and forth, the discrimination just going back and forth, people being called by their diagnosis instead of by their name, when you hear that going back and forth and the supervisor just sits there, the peer no longer feels that they're supported. Because when I get up from the table, you could be talking about me the same way. So as a supervisor, you have the opportunity to change that work environment. And so moving forward, it's crucial to continue implementing and refining the strategies that I've shared here to ensure long-term success and the well-being of peer specialists within mental health settings. Not saying that everything here has to be done. Maybe some of these you've already overcome, but moving forward, you must continue them. Again, these are just 3 of the challenges, and I'm sure that there are many more. But these are just 3 of the challenges because I only had a little bit of time because I could do a whole lot. But just these 3, I felt were very important in the climate that we're in today. And so retaining peer specialists is essential for maintaining high quality mental health services and promoting recovery-oriented care. Why do you ask? And you probably didn't ask, but why? Because living experience is not found in a book. Recovery is person-led, and as peers, we are living examples that recovery works. And because recovery works, because in the mental health, because when promoting mental health services, substance use services, when promoting that, people need to see that I can overcome. I can recover. Recovery can be in my vocabulary. And so by understanding the unique challenges faced by peer specialists and implementing targeted strategies, as supervisors, you can create a supportive and inclusive work environment that enhances the retention rates and promotes the well-being of the peer specialists and individuals that they serve. So that is the presentation. And I have a comment here that I hadn't read yet. Megan says, I started something at work called the Sunshine Committee. I want everyone to know that I just don't want them to come to work to make money. They are needed, wanted, and appreciated. Awesome. Thank you, Megan. And that is exactly what, as a supervisor, one of the things that you can do. Thinking outside of the box. Thinking of things that you can do to bring the team together so that no one feels like they are an outsider, especially the peer, because we are working with people who we see this, and sometimes we see these people as a mirror, because we remember, I used to be there. I used to be like that. I was in a similar situation. And so because of that, we sometimes get triggered. We sometimes get stressed. We sometimes have these remembrances that cause us to go back. But when we have the support of our team and our supervisors, then that lets us know that we are in a good place, that we are in a good place. And we may not want to leave there. But also the environment is not only good, but where do I go from here? Where do I go from here? So I like to invite any questions. My contact information is there on the screen. And I will also put it in the chat box. And thank you all very much. Let me go back to here. Okay, thank you all very much for your time. And are there any questions about anything that I've covered? If you'd like to put it in the chat, or if you want to raise your hand, we have a few minutes left that I can entertain any questions or comments that you'd like to make. Yes.
Hi, Dr. Cash. I have one question for you.
Yes.
What do you do when a fellow peer support or employee calls you stuffy, high horse because you follow rules? And my reaction was, we all have rules, because you get up in the morning, you eat, you brush your teeth. That's a rule.
Yes.
But I'm kind of old school, but I don't consider myself stuffy and high horse by following a rule. What is your take on that, please? We lost you.
I think perhaps we lost Dr. Cash again.
I think so.
She said, just joking. I don't need to answer questions.
Hmm.
Well, while we're waiting for her, would anybody be able to share the link to get back to the schedule? I accidentally exited out of it and now I can't.
Yes, I can put that up for you, Lacey.
Thank you.
I'll put that in the chat, okay?
Yep, thank you.
Okay, that's the full schedule is at that link. And you can click on any of the live links in the schedule. It'll take you right to that session.
Okay, thank you.
You're welcome, Lacey. I don't know if Dr. Cash is having any luck signing back on. While we're waiting, I want to thank everyone for attending today's session. I'm going to share a link in the chat. That's for the evaluation of this session, and also it's the link for requesting a certificate. Okay? I'm going to put that in the chat right now. It doesn't look like Dr. Cash is coming back. I want to thank everyone for attending today, and please click on the link to evaluate today's presentation, okay? Thank you for attending, and enjoy the rest of the conference today. Okay, the next conference, the next session in this room is Develop Your Next Hires, the ins and outs of creating an apprenticeship program, and it's being presented by Alexandra Mendoza. So that starts at 12:30. We're taking a lunch break for 45 minutes until then. Well, we hope to see you then. Okay? Dr. Cash, we weren't sure you were going to be able to make it back.
Okay, yes. At a power outage.
Okay, I already I closed the session already.
Okay.
I'm still here. I have a question for you if you don't mind.
Okay.
I actually am very big on, I don't expect anybody to do anything that I would not do. I am lead by example. I don't rule with an iron fist. I don't do anything like that as a supervisor. Are you still there? Or are you just frozen?
Wait a minute, start again?
Sorry, I was saying, can you hear me?
Yes, I can hear you.
Okay. I was saying I am a supervisor that I lead by example. I don't rule with an iron fist. I don't do anything like that. I actually have really great rapport built with all of the four, three. I just had somebody unfortunately had to resign effective immediately the other day due to childcare issues. But I have a question for you. I have one in particular, employee in particular, and she really struggles with, obviously, with her own lived experiences and things like that. She probably calls me 4 or 5 times a day. She definitely needs the hand holding, which I don't mind. I don't mind assisting her. I don't mind doing anything like that. But she really struggles with her own concerns of not being good enough, not doing the right thing, worrying about everybody's talking to her, talking about her consistently, worrying about just that she's not good enough. And I really try to like pick her up, and like we have conversations about, hey, let's really work on building your self-esteem. Let's work on building those kind of things. Like I had a talk with her the other day about, hey, what would you be interested in looking at one particular thing? Let's say that you're really interested in, let's say ASD, autism, things like that. How about doing some deep plunging into some research on autism, learn those kind of things. Granted, does she have lived history? No. So we could probably find something about lived history. Her child has a pretty big like ODD and things. So ODD, let's go there. ODD could be something that you really dive into, and you will learn stuff for your own family. You will also be able to carry your things along, that your living experience plus your knowledge that you've learned by research into that. But she is just consistently, like today, she had called me during this meeting and she's like, is my job in jeopardy? And I'm like, I'm not sure why you're asking that question. Like, absolutely not. Like, we would have many conversations before you were, because I really thought that my job is in jeopardy. I'm like, I'm sorry that insinuate, show, do anything that I would ever, you would ever feel that way. And she's like, well, no, I just worry about it all the time. So with all of that dump being said to you, how would I support her? How would I support her further than what I already do at this point in time?
I believe you are doing excellent. Okay. It just goes back to, you can, as long as you are giving, as you are doing, that person has to receive it. So the things that you're doing, the reassurance, the open door conversation, the open channels of communication, the whatever, all the support that you're giving her, is great. If a person has trust issues, or if they're going to worry, they're going to worry.
Okay.
And at some point, and how long have you been, has she been an employee?
June will be a year.
Okay. So the more that she sees you continue to do this, the more her guard will come down and she'll be able to trust you. So just keep doing it, because, because I know about trust issues. When you have trust issues,
right.
I have trust issues. If you tell me sky's blue, I got to look out the window, because I'm
same, right.
So you just keep doing what you're doing, keep the encouragement. And whenever you have a conversation with her, if she's doing good, tell her she's doing good. If she's doing bad or she needs some improvement or something, tell her that way. And I don't know if you've ever heard of a praise sandwich.
Mm-hmm. Yep.
Okay.
Good, negative, good. Yep.
And that'll help reinforce that her job is not in jeopardy, but there's something she needs to do so that it won't be in jeopardy. If that makes sense. Okay.
Oh, 100%. Yeah, I definitely try to do that. I don't ever want to say walk on eggshells, because I'm not a walk on eggshells. I'm a very big supporter. Obviously, like you've said multiple times, we are in this profession because we're peers, because we have lived experience, and I will never berate anybody that that's under that I supervise. And so I'm like, oh my God, what can I do to help support her more? I even brought her along. She's joined my sunshine committee, brought her along to bring sunshine to other employees, to be able to help build morale, to help build hopefully her own self-esteem, to feel like she's part of the team to continue to grow. So that was the only thing I wanted to ask. Thank you.
Thank you so much. Thank you so much. I know we're about out of time, but if these last two questions, Jerry, you had a question or a comment? You're muted. You're muted. Jerry, you're muted.
Sorry. Okay. I work at a mental health facility, and our entire peer support specialist team, we are now all certified. And so now, especially with the Prop 1 going through, our place of work is moving towards making us billable. And our team is on edge, because they are already, when I say they, the clinical portion of the team, they're already looking at telling us, okay, your expectations are going to be the same as the clinical team, 100 billing hours, a month, and, all these things. And so the team they're really on edge about how is that going to look for us, with the clinical team carrying caseloads of 40 to 50 people, how are we going to be able to really support, our clients, and not have that, where we in the past, we haven't had that time frame. We had time to be able to build rapport and go and support however, however it looks like. And with this mandate that's coming up, everybody is really on edge, as it appears that they're going to be looking more at billing hours more than, us supporting the clients the way we've been able to support with our lived, and I'm a person with lived experience also as well, and it has been wonderful. We bring wonderful support to the mental health team, because most of our referrals in the beginning were to engage with clients, hoping to build a relationship in hopes that they would participate in their mental health. And then, but along with that, we would be able to help with all other type of social activities and things like that. So have you had that, or how would you think that I could support my team with that anxiety, or even go to, the powers to be, to have our voices? We won't be able to function like that, like the clinical in that way. Does that make sense?
It makes sense. It makes sense. And it's just something that you'd have to look at. Now, I'm not sure in terms of the codes, the billable hours, how much time you need for whatever. But just from my experience, when we were given a quota, what I did was I did groups. And in doing the groups, I was able to touch everyone. Okay. And then because we were developing a relationship as a group, then I was able to continue those relationship building separately. So it wasn't, when I meet with somebody one-on-one, it wasn't starting from scratch, because they already knew me from the group.
Okay.
And that's one thing that I did, because again, we had the same thing where we were told that we have to see 50 veterans. We had to do 55 notes in a month.
Mm-hmm.
And I did almost 100 in a week, because I did 4 groups a week.
Okay.
And then there were those in the groups that needed additional help, additional support. Then I was able to, branch them out. And sometimes I did 2 at a time and 3 at a time. But the group was, however way the group you can handle to manage, usually no more than 10.
Okay.
So they have a chance to talk and express. Mm-hmm. And then you would decide that from your clients. Maybe the group may need to be smaller than 10, maybe 7, and then you would be able to deal with each one. You see what are the issues, and then now you are able to address those issues. So you save time,
Mm-hmm.
that fact-finding time, by doing it during the group.
Okay.
And then the only thing is figuring out how to bill for it.
Right. Okay.
Okay.
Thank you so much. That helps.
Yeah, if you want to reach out to me, you can.
Okay. Thank you so much.
You're welcome.
I will. Thank you.
And Kat?
Hello, how are you?
Hi.
I really enjoyed your presentation. I do have a couple of one question, really. How do you manage performance evaluations while people are navigating the lived experience? So my lived experience is more directly related to my ex-husband and some things with my children. And so I have a lot of compassion for what that looks like. But however, I have team members that, do have lived experience. However, it does at times impact our team. It may impact the support of us actually being able to provide services for care seekers. And so while I want to balance my level of compassion, how do I navigate the expectations of being a supervisor on a chat line and having people that, causes sometimes attendance issues, other things like that, where they're not quite as engaged. And so in performing and evaluating those people, what does that look like, in that performance when you're comparing with other team members that may have navigated more quickly through their lived experiences and have been able to, create a sustainable job environment versus those who are still struggling in managing that.
So as a supervisor, making sure that you recognize that everybody's on their own recovery journey.
Correct.
And even though, like you said, others may have figured out how to balance both of them, those who have not, work with them even more, providing them resources to help them balance, check in with them more often. Those are things I would suggest, because one, that lets them know that you care about their performance, that they're not just there so that you can have somebody in the space. You care about them doing the job and doing it well. So you're willing to help them, to support them with resources. Now, you're not becoming their therapist. You're not becoming, that, but you are supporting them with additional resources that will help them be able to balance. Some of that could come from your lived experience. Some of it can come from others' lived experience, and even having a team meeting and have people talk about what's going on with them and how they manage things. And that could also be an encouragement to the ones who haven't figured out, because they could hear something from another person that they may use in their own life to manage and balance their own lived experiences. Does that make
So
sense?
how do we navigate the underperformance given the realities of that? What does that look like from a business organizational standpoint?
Well, you definitely, because this is a business, you definitely have to talk, when you talk to the peer, and when you let them know that you care about the fact that they're performing poorly and that you're willing to help them and support them, then they should want to do whatever they can do to keep their job. You're letting them know that they're performing poorly, but you're also there to give them a plan, set goals with them, do what you can do with them to get them up to par. Because you don't just want to keep doing poor performance, because at some point it's going to be time to go. But so you'll know if they're working on their performance. They may not work on it as quickly as others, but if they're working on their performance, then that definitely gives you something to gauge for them in their poor performance evaluations, letting them know, okay, I see you're improving. I see you're doing this, let's look at what you're doing and let's see what we can do if we can move it forward to do something else.
Okay. And then I guess the one last statement or question, kind of mixed, is, recognizing that a person is not their diagnosis, right? Mm-hmm. What do you feel is language, word choices, so that person can distinguish between that? Because you don't ever, I never want anybody to feel like, it's their diagnosis. You know what I mean? Because it gets mixed up, right? I mean, if you have a person that's performing, you have other team members that may not have, the same level of challenges at the time or whatever. And admittedly, sometimes you forget, you kind of get on the wheel. So do you have a language where you're reinforcing that you recognize that a person is not their diagnosis, yet there's still an expectation in the position? Because it gets really sensitive, and these are people that many people I enjoy working with. Just mm-hmm. Sometimes again it just gets mixed, right?
So I believe just the mere definition of the word peer, because as a peer, there is, the peer is the only profession that your coworkers know that something is going on with you. So if you use the word peer, if you use the label peer, and you talk about the team as peers, then you're not calling anybody out. You're not exposing anything. You're not making anybody feel like they are less than. But it's basically saying we all have something going on, and that's everybody on the same playing field. And if you address them like that, then that's how they'll feel. And if they want to do something deeper, then that's their choice. But as you're addressing them, if you use the word peer, some places use peers, some people use navigators, whatever you call them. Yes, Betty said, I'm Betty, not asthma. Yeah, so they're all peers. And that would be a great start, because that lets them know that you recognize that there's something going on, but they are not what's going on. They are not their diagnosis.
Right. But as she said, so I like the example, and I'm sorry, I don't want to drag this out, but I just I really want to be sensitive in this, and this was a really great reminder. So she says, I'm Betty, not asthma. But if she has asthma attacks that constantly keep her off of work, yes, you're Betty, not asthma, or you are Betty, not asthma, but you underperform consistently
because of your challenges.
Right.
That's like, because of your challenges.
Right.
Uh-huh. And that lets them know that you recognize that there's a challenge, but in their challenges are making them underperform, but you're not calling them their challenge.
Right.
Dr. Cash, I have to point out we're halfway through our lunch break already.
All right. Okay. I'm sorry. Thank you. Thank you very much.
Thank you
Have
all
a good
so
day.
very much. I appreciate the comments and the questions. Billy, thank you so much for working with me through these power outages.
You're welcome,
All the
Dr.
days
Cash.
to have a power outage.
Dr. Cash, could you put your contact information in the chat for Jerry Spruill?
Yes. Yes.
Thank
I
you.
will do that. Okay. Thank you very much.